Dr. Mike here with Crossover Physical Therapy. Today I want to talk to you about the lumbar spine, also known as the lower back. Reason why? Well, our star hockey player, Zach Parisi, went under a microdiscectomy surgery this morning. So why would we want to do that for him versus maybe just kind of wait it out, do some more specific rehab for maybe the general pop? So one thing is we're going to take a look at is the lumbar spine here. So we have 5 vertebrae, 1, 2, 3, 4, 5, these little white spots outlined. And we have the disc represented here in green. The disc has been pulled out, showing you here, and then flipped up, showing you here. So the disc, as flipped up, as you see, it has we have a bunch of fibrous rings around that disc, and inside that disc is a gelatinous mass called the nucleus pulposus. So that disc, you can think of as kind of like a jelly donut. You know, if we're continually causing what we call a flexion moment or causing flexing of the disc, that means we're actually pinching the front here and putting a lot of pressure on that disc to the back side. So repetitive stress to that can cause tearing of that fibrous rings. And those fibrous rings are highly innervated, have a lot of nerve endings in there, so if there's been a disruption there, they can be very painful. That's why you see people kind of shifted if they have their back act up a little bit. All right? If it continues to happen, well, and enough weakening happens to the disc, what can happen? We can have a bulging disc. All right, so we said bulging disc versus a herniated disc. Now, bulging is that gelatinous mass is not pushing through the disc yet, but it's starting to make the disc pouch out. So it can take up a little space, cause some irritation into the space where like nerve roots move. But then you have that herniated disc where that gelatinous mass is actually torn through all the layers and actually is taking space up in the vertebral column. So the reason why the vertebral column is so important, well, that's where the spinal cord comes down, and down at this level, you have the nerve roots that innervate the leg and get your brain to connect to the muscles and then the sensory receptors to connect to the brain, let you know what's going on down there. Can get disrupted because there's not a lot of space where those nerve roots come out. So if you have any other mass or that disc taking up space there, it's most likely going to start rubbing on, irritating, or even pinching down on that nerve root. And that's where you have people that say they lost strength in their leg. That's where they talk about, that my leg's numb, or they even have shooting pain going down their leg because not that they have an issue in the leg, they have an issue in the back, which makes them think that their leg has a problem. So, why do we want to take care of this? Long-term compression of the nerve can have residual weakness for quite a long time. It has to heal from the back all the way down the leg, depending on what much it is involved. Other thing is that conservative rehab has been shown to be very successful for the rehabilitation of this. And so in Zach Parisi's case, he actually did conservative rehab, did have positive results for it, but then he had another injury which exacerbated the other issue, and that's why surgery came on at this point. But for general population, even that weekend warrior, surgery does not necessarily have to be an option for you. You can definitely take care of this with conservative rehab, physical therapy, to get you back to your goals and get you back to the things you want to do. All right. So a lot of times where surgery might be coming into play is that just your general presentation. Is it really something that has been that detrimental? The weakness is usually the biggest thing that we want to take a look at and make sure we can't have an effect on before consulting for that. All right. So biggest difference, we talked about herniated disc. Remember that herniated disc is that gelatinous mass pushing out. That bulging disc is just starting to push the layers out towards that spinal column. So if you are struggling with low back pain, or had a long history of low back pain, there's definitely things to help you get your quality of life up. If you have any questions for me personally, you can always give me a call here at 763-595-1300. If you want to schedule a consult or an evaluation, you can go on our website, www.crossoverphysicaltherapy.com. Sorry, yes, it's all spelled out. And then we look forward to hearing from you or seeing you. Have a great day.